Questions 461 to 500. 461. A 5-month-old boy has been vomiting green-colored vomit. He has intermittent abdominal pain during which he draws his chest, turns pale, and cries forcefully. On observation, in the stool, which has a jelly-like consistency. Abdominal pal a long, tube-like mass. There is no fever, rash, nor diarrhea or hyperactive in all quadrants, which is the most likely form of initial treatment. A. Manual manipulation. B. Surgical resection. C. Normal saline enema. D. Laparoscopy. The answer is C. Normal saline enema. 462. A 7-month-old infant seen in the emergency department suffering from episodes of severe abdominal pain, and the infant's stool became like red jelly. Abdominal examination revealed palpable sausage-shaped mass in the right upper quadrant. Which of the following is the first line of therapeutic management for this infant? A. Non-surgical hydrostatic reduction. B. Surgical simple reduction. C. Pyloromyotomy. D. Endorectal pull-through. The answer is A. Non-surgical hydrostatic reduction. 463. 7-month-old infant seen in the emergency department suffering from episodes of severe abdominal pain, and the infant's stool become like red jelly. Abdominal examinations revealed palpable sausage-shaped mass in the right upper quadrant. Which of the following is the best diagnosis? A. Hirschsprung disease. B. Hypertrophic pyloric stenosis. C. Infant colic. D. Intussusception. The answer is D. Intussusception. 464. Nurse is preparing to care for a child with a diagnosis of intussusception. The nurse reviews the child's record and expects to note which sign of this disorder documented. A. Watery diarrhea. B. Rib bone-like stools. C. Profuse projectile vomiting. D. Red jelly stool. The answer is D. Red jelly stool. 465. 5-year-old child was seen to the emergency department. Abdominal pain, palpable sod-shaped mass, and intussusception is suspected. Which of the following is the best diagnostic evaluation to? A. X-ray. B. Endoscopy. C. Rectal biopsy. D. Ultrasonograph. The answer is D. Ultrasonograph. 466. 5-week-old newborn was admitted to pediatric ward with pyloric stenosis. The newborn has weight loss and projectile vomiting during feeding. They scheduled surgical repair of pyloric stenosis. Which of the following postoperative intervention for this? A. VV fluid. Infant is retaining adequate amount by mouth. B. Administration of proper analgesia until infant discomfort resolve. C. Start feeding immediately after postoperative. D. Vomiting is uncommon in the first 24 to 48 hours. The answer is A. VV fluid. Infant is retaining adequate amount by mouth. 467. Surgery for pyloric stenosis movement? A. Pylorotomy. B. Pylorectomy. C. Pylorostomy. D. Pyloromyotomy. The answer is D. Pyloromyotomy. 468. Pyloric stenosis, peristalsis movement? A. From right to left. B. From left to right. The answer is B. From left to right. 469. 1-month-old infant is admitted to the surgical unit with hypertrophic pyloric stenosis and scheduled for the surgery. Which of the following is the findings of abdominal examination? A. Palpable olive-like mass in the left side. B. Palpable olive-like mass in the right side. C. Palpable olive-like mass moved from left to right. D. Palpable olive-like mass moved from right to left. The answer is B. Palpable olive-like mass in the right side. 470. A 7-week-old infant boy is admitted with projectile vomiting, decreased urine output, decreased bowel movements, and weight loss. He is poor turgor and appears hungry. The nurse observes left to right peristaltic waves after he vomits. The nurse would expect to find which of the following during the physical assessment? A. Hepatosplenomegaly. B. A palpable pyloric mass. C. Lymphadenopathy. D. Bulging fontanelles. The answer is B. A palpable pyloric mass. For 71, the nurse is assessing a child, an infant, with pyloric stenosis. Which of the following is likely to note? A. Diarrhea. B. Projectile vomiting. C. Swallowing difficulties. D. Current jelly-like stool. The answer is B. Projectile vomiting. For 72, a 5-week-old newborn admitted pediatric ward with pyloric stenosis. The newborn has weight loss and projectile vomiting after feeding. Which of the following abdominal organs are directly affected when stenosis diagnosed? A. Stomach and duodenum. B. Stomach and esophagus. C. Liver and spleen. D. Liver and bile duct. The answer is A. Stomach and duodenum. For 73, tetralogy of Fallot, where is it located? A. Right heart side. B. Left heart side. The answer is A. Right heart side. For 74, the Foley family is caring for their youngest child, Justin, who is suffering from tetralogy of Fallot. Which of the following positions is used for congenital heart condition? A. Semi-Fowler's position. B. Knee-chest position. C. Prone position. The answer is B. Knee-chest position. For 75, a 9-month-old child who has a repair cleft palate. The nurse explaining mother on how she will give feeds to her child. Which of the following instruction can be expected to include feeling education? A. Open cup. B. Teaspoon. C. Bottle feed. D. Special bottle feed. The answer is A. Open cup. For 76, which of the following instruction should be given to the parents about colostomy care? A. Use baby powder after stoma cleaning. B. Empty the pouch when it is completely full. C. Avoid tight diapers around the infant abdomen. D. Use baby wipes to clean the skin around the stoma. The answer is C. Avoid tight diapers around the infant abdomen. For 77, a community nursing nurse is working with a family in their home. The parents complain that their 8-year-old son is wild and that he never listens to them. They become upset at his antics to gain attention from the nurse and send him out of the room. Which of the following responses from the nurse is the most appropriate? A. That was the right thing. It teaches him who is in charge. B. Don't worry, he is a boy and with time, he will grow out of this. C. Let's talk about how we can teach your child the right behavior and your expectations of him. D. You are only reinforcing his behavior when you do that. Try putting him in time out instead. The answer is C. Let's talk about how we can teach your child the right behavior and your expectations of him. For 78, 11 child is admitted to the pediatrics ward with acute lymphocytic leukemia and has had joint pain for several weeks. Physical findings: widespread ecchymosis, generalized lymphadenopathy, hepatosplenomegaly, and pallor. Lab work shows a low hemoglobin level, RBC count, low WBC count, low hematocrit, and low platelets. Which high risk is expected? A. Infection. B. Fractures. C. Dehydration. D. Hepatitis. The answer is A. Infection. For 79, a nurse is teaching a group of new mothers in the postnatal ward on how to manage breast engorgement after they are discharged to home. Which of the following statements by the mother will indicate to the nurse that they understood how to prevent engorgement of the breasts? A. Breastfeed every 4 hours. B. Breastfeeding during the day and bottle feeds at night. C. Breastfeed every 2 to 3 hours during the day and stop at night. D. Breastfeed the baby every 2 to 3 hours during the day and night. The answer is D. Breastfeed the baby every 2 to 3 hours during the day and night. For 80, when would the nurse schedule a woman for a glucose tolerance test? A. 6th to 10th week of pregnancy. B. 12th to 16th week of pregnancy. C. 24th to 28th week of pregnancy. D. 32nd to 36th week of pregnancy. The answer is C. 24th to 28th week of pregnancy. For 81, which of the following is the most common site to obtain a capillary blood sample from neonates? A. Heel. B. Earlobe. C. Fingertip. The answer is A. Heel. For 82, mother came to the clinic and afraid that her baby maybe will have meningitis as his brother already have. What should the nurse tell the mother? The answer is, the vaccine is reducing the risk for this disease. Temperature 41 degrees Celsius indicates blank. The answer is hyperpyrexia. For 84, when checking rectal temperature, how depth thermometer should be inserted? A. 2 centimeters. B. 3.5 centimeters. C. 4 centimeters. D. 4.5. The answer is B. 3.5 centimeters. For 85, patients with cardiac disease, the nurse should avoid which of the following place when taking temperature? A. Rectal. B. Oral. C. Axillary. D. Tympanic. The answer is A. Rectal. For 86, a 15-year-old girl is admitted to the hospital with diarrhea. She has been repeatedly vomiting for now weak and lethargic. She is oriented to time to questions appropriately. The nurse prepares temperature using an electronic thermometer. Which measurement would be most appropriate? A. Oral. B. Rectal. C. Axillary. D. Tympanic. The answer is D. Tympanic. For 87, a fastest and most sanitary thermometer is A. Glass. B. Electronic. C. Chemical. D. Tympanic. The answer is D. Tympanic. For 88, how to storage vaccines? The answer is in ice. For 89, 9-month vaccine. A. MCV4. B. Hepatitis A. C. HIV. D. MMR. The answer is A. MCV4. 490, 1-year vaccine. A. OPV. B. HIB. C. DTaP. D. Hepatitis A and varicella. The answer is A. OPV. 491, 18-month vaccine. A. Rota. B. Hepatitis B. C. Hepatitis A. The answer is C. Hepatitis A. 492, first dose of hepatitis B should be given when? A. At birth. B. At 2 month. C. At 6 month. D. At 1 year. The answer is A. At birth. 493, measles vaccine administration route. A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Intravenous. The answer is B. Subcutaneous. 494, DTaP vaccine administration route. A. Intramuscular. B. Subcutaneous. C. Intradermal. D. Intravenous. The answer is A. Intramuscular. 495, what of the following disease are prevented by MMR vaccine? A. Mumps measles scarlet fever. B. Mumps measles rotavirus. C. Mumps measles rabies. D. Mumps measles German measles. The answer is D. Mumps measles German measles. 496, a mother brought her 6-month-old healthy infant to the Well Baby Clinic. Which immunization should the nurse anticipate to administer as per World Health Organization's recommendation? A. Varicella, chickenpox. B. Rotavirus and hepatitis. C. Measles, mumps, rubella. D. Diphtheria, tetanus, and pertussis. The answer is D. Diphtheria, tetanus, and pertussis. 497.6-month-old boy with hydrocephalus is admitted to the pediatric surgical ward for ventriculoperitoneal shunt, VPS, insertion. Which of the following findings should be of the most concern when assessing the child postoperative? A. Sunken fontanelle and irritability. B. Decreased head circumference. C. Poor feeding and pupillary change. D. Headache and excessive sleepiness. The answer is C. Poor feeding and pupillary change. 498. Which of the following routes is used to administer diphtheria, tetanus, and pertussis DTP vaccine? A. Oral. B. Intramuscular. C. Subcutaneous. D. Intradermal. The answer is B. Intramuscular. 499. The nurse are reviewing the immunized schedule. If the 11-month of baby, which of the disease should the nurse expect the infant that here immunized against? A. Pertussis, tetanus, polio, and varicella. B. Polio, pertussis, tetanus, and diphtheria. C. Varicella, polio, tuberculosis, and pertussis. D. Measles, mumps, rubella, and tuberculosis. The answer is B. Polio, pertussis, tetanus, and diphtheria. 500. Define dexamethasone, blank. The answer is accelerates maturation of fetal lung.